Good afternoon, everyone. My name is MJ, and I am the Event and Marketing Coordinator at Recreation Connections Manitoba. We're thrilled to have you today to discuss reopening sport, what you need to do, what you need to know. Before we delve into today's webinar, I'd like to acknowledge that Recreation Connections Manitoba is located on original land of Anishinaabe Cree, Oji Cree, Dakota, Dennis people, and on the homeland of the Métis Nation. Our office sits on Treaty 1 territory, the ancestral and traditional homeland of Anishinaabe people. We respect the treaties that were made on these territories, we acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. Once again, welcome to today's webinar. You will have the opportunity to submit your questions to today's presenter, Kylo and Janet, by typing your questions into the question panel on your control panel, and that should be on the right-hand side of your screen. During the presentation, you can type in your questions at any point, and we will answer all these at the end. I'd like to welcome Janet McMahon and Kylo Harris. Janet has worked in sport administration for over 30 years, playing various roles. Currently, she is the Director of Sport at Sport Manitoba. During COVID, she has worked closely with Provincial Sport Organizations in the development and review of return to sport plans and protocols. Kylo Harris has worked in sport and recreation industry for over 21 years, working with large urban centers, rural regions, and northern remote communities. As Partner Development Manager for Sport Manitoba, Kylo communicates with sport partners on various topics, including the implementation of return to sport plans and protocols. Thank you, Janet and Kylo. Over to you.
Thanks, MJ. Just sort of getting my clicks in order here now. For those of you that I've been on virtual calls with previously during the pandemic time, you'll be happy to know that I made the drive into Winnipeg today to make sure that I have stable internet connection. So it should be a little better than some of our previous Zoom or GoToMeeting calls that I had with some of our rec professionals over the previous few months. So we'll just cross our fingers and hope that that stays the course today. Just to give us a bit of an overview before we move too deep into the conversation, a couple of topics that Jen and I wanted to discuss with everybody was first the big piece around the return to sport process and what that looks like. Some of the conversations that we've had over the previous few months around the non-provincial sport organization governed sport and what that looks like, where our programming is executed through facilities, both in providing the field of play or a facility or program that wishes to provide programming ongoing, and then some resources and what we know to be where the heart of the information lies is when we get into the question and answer period, because as you'll hear throughout the beginning part of the conversation, most of these situations are going to be unique and situation, community to community, and sport to sport with some differences in them. So we want to get to that question period and hope to have a dialogue with you around some of the things you wish to know more about. With that being said, to get things moving first in our key is the return to sport process and what that looks like. I'll turn it over to Janet, who's been involved on that from day one with our partner organizations.
Thanks, Kylo. So this is a process actually that's been well established here, and I think we're actually up to about 45 sports that have submitted their return to sport plans or protocols, whatever you want to call it. The challenge with all of this, with I think everything COVID, is there's more questions than there are answers, and it's always evolving depending on specific situations. So for most of you, I think probably know that the province has now announced phase 4, which is actually supposed to take into effect on the 25th. This really has no impact on sport and our activities at this point, except around, I guess, size of gatherings. So could have an impact on spectators. A number of sports have put in place that only one parent is able to attend an indoor event and that sort of things. But everything else that was established in terms of the guidelines have not been changed, and it doesn't look like they will be. So in terms of the process, I would also compliment the provincial sport organizations. Most of these plans have been very well conceived. They're very comprehensive. They've worked closely with the other provinces and territories, and especially with their national sport organization. The thing we have to remember in all of this is people will say to me, well, that's allowed in Alberta or that's happening in Ontario. But we have to use our Manitoba health rules, and even though our contagion rate is much lower, it's things like language and some of the guidelines are different. So in a number of the plans, they talk about bubbles, they talk about cohorts. We don't use that language here. We use households and other things. So it has been a challenge for some of the provincial bodies to communicate to all of their partners and have some kind of insurance that the rules that they have established are happening. The other thing to note is that most provincial sport organizations, I'll refer to them as PSOs because it's just too many words, they've all pretty much established a phased-in approach, and most of them are currently really only in phase 2, which would mean they initially started with basically training and skill development, and that was phase 1. So there was an opportunity where people could still have practices or train with a coach and still physically distance and not really have any contact with one another. Most of them have now moved into what I'll call small-sided games, 3-on-3, where they're actually, throwing and catching with one another, kicking a ball to one another. At this point, there still really is not a lot of contact. Probably the place that you'll see it the most would be soccer, and there is really no sport that is fully into competition, traveling, or having tournaments. Now, that being said, Kylo might speak to the non-sanctioned bit of that as we move forward. I noticed that he's put on the screen the process, so I'll just walk you through this, and it's actually quite simple. The PSO has been asked to develop their modifications or the changes that they need to make to their sport in order to make it safe. They submit that to Sport Manitoba, which is myself, Jeff Natchik, and I review them. We pass them on to an MLA who's been given the responsibility around this. It's actually Greg Nesbitt, and then Greg passes it on to whoever it might be within health. Then we usually have something back from them, and Sport Manitoba then communicates in writing to the Provincial Sport Organization either some modifications that might be required, or you're good to go, or you're only allowed in phase 1 and phase 2. So again, the process is quite clear in how it works, but there's always complications along the way about questions for this and that. So we have been dealing with Ask Health quite a bit, and actually because we now have several sports that want to move into contact, we have a big meeting with them on Tuesday. So hopefully we'll get some more direction around some of these little intricacies that are difficult to determine in sport. So the other thing that some of the sports are having some difficulty or are not reopening based on their facility. Things like pools, things like school gymnasiums, fields, etc. So some of the sports that would like to reopen have a barrier from the fact that they can't access their venue at the moment. And if you are looking for some of these return to play protocols, a lot of them are posted on their website. Most of them have been really, really good about sharing this information. So I know we had baseball on the first slide, but I know soccer, softball. If you're looking for samples, those are ones that are definitely available to you. The other thing that you may want to know if you are hosting any sport-related activities, a number of sports have implemented a COVID waiver or a declaration of basically of indemnity. And this is mainly because most of our sports are insured by our insurer, the same insurer, who has identified a contagious contagious exemption for liability. So this has put people, I think, a little bit more on high alert about the fact that what would happen if somebody was ever able to prove that a provincial sport organization was negligent. So it is a concern. Some sports have gone out and found an insurer for this, but a lot of insurers do not cover pandemics and contagions. So who creates it? The sport creates it. It's passed on to us. We pass it on to the MLA, which is the province of Manitoba. It's reviewed by health, and then it comes back to us. The question, and probably some of you ask, who enforces it? Again, that is not our role and responsibility. It is public health officers identified through the province of Manitoba. Probably the most that we've seen is really around restaurants and that sort of thing. There have been some cases for sure that we've reported some activity that we felt didn't meet the protocols or the guidelines, but really our role is to make sure that whatever the organizations are submitting to us do meet the guidelines. So I'm sure that lots of you will have questions. I'll leave it to MJ about whether we want to take them now, but I'll pass it back to Kylo and he can talk a little bit about the non-governed activity.
Thanks, Janet. Yeah, and as MJ mentioned at the beginning, by all means, we can use the chat box, and she's helping us collect those questions. If there's an immediate question on something that we're presenting on or discussing, there's a raised hand function. I haven't been on this side of GoToMeetings before, but if it's used, I'm sure MJ or us will get a notice. So with some of the conversations we've had previously are around those sports that don't have a provincial sport organization responsible for them, or that are not members of that sport organization as Sport Manitoba defines them. And so a couple that I chose that we've discussed would be one like a pickleball, and this is from their website. And so some of the organizations have gone ahead and created their own Restoring Safe Services plans. So that information is available on the site. So if you are having conversations with or do see some participation in your communities or through your facilities for that sport, you may want to just quickly do a look and see, because they are some that are present and do have some information made available, similar to what the provincial sport organizations have. And then the other one that we commonly see is youth sport that maybe is not a member of the provincial sport organization at all levels. And so that very entry-level community-based soccer program that runs in your community may not be a member organization with their youth soccer, their U9s or their mini soccer programs. And so they have the opportunity to apply the Manitoba Soccer return to play protocol if they wish, and we've seen some sports choose to do that. But at the very base level, they still are required to follow public health guidelines, and that's the important piece. Is if it's a sport existing in your community, that even though there's not a return to play protocol for that organization as a sport not governed by the provincial sport body, they would still have to follow all the required health pieces. And so a conversation with your community group about that, especially if they're utilizing your facilities. And I believe it was Dauphin's facility I read recently, they've actually asked that their non-member sports that might be participating on Dauphin community sports complexes follow those protocols and use those protocols in place. And so much to Janet's point earlier that some of our facilities may or may not be open, there are requirements that you can put in place that enhance some of those community pieces if you're looking for material and guidelines to help with that safety of the participants. On the facility side specifically, we really do see two avenues in where sport occurs, and one of that is recreation facilities and communities providing the field of play for sports. And so whether that's a community-owned soccer pitch or local community center, recreation facility, multi-sport plex, that they, or you in this case, are renting your facility for field of play to the sport. And again, if that sport's to participate in your facility, then they should have protocols in place. If they're a member organization of a provincial sport body, then those return to play protocols are being implemented by the sport participants as far as rules of the game, some of those common entry points where if their dressing rooms are used, they're maybe making considerations for how a coach uses that space, how many people can be in that space. And those are areas where, as a facility owner, you're going to have influence as well, and you may have protocols that are opposite or more strict than what the sport is putting in place. And of course, that's going to be determined by square footage and a variety of things. And so as a facility owner, where you're providing the field of play for the sport, obviously there's going to be a lot more enhanced conversations with your community user groups and understanding that they will have the information about rules of play and engagement that might be modified from the Provincial Sport Organization, and you will have to enhance that discussion with them around what your facility access looks like, about is there a requirement to be screened at the door, or is that self-screening process that's in place through the Provincial Sport Organization meet both the demands of the facility and the user group. The other one that we've come across and is just the opportunity for a recreation or community, a rec department or commission or community group to provide sport programming, whether or not that's through day camps, multi-sport experiences, summer recreation programs. And again, it's not mandated necessarily as a governed provincial sport organization event, but it would be one of those opportunities to say, here are some of the considerations that a sport like volleyball has put in place with regards to programming and how they are returning to play safely, that a community group using your facility or you as a facility looking to initiate programming could use those protocols as guidelines to say, this is how we are safely returning to activity, and putting in place some of those similar conditions that the Provincial Sport Organization has implemented. Or in the case of an organization that hasn't been approved yet, applying those general public health practices that we know around physical distancing and sanitization and just general hygiene, hand hygiene, and making sure that those are factors, much like we've seen many rec departments and commissions with summer programming around the arts and crafts piece, and how creative you have been on ensuring that you can provide quality programming in that space and applying the health restrictions. And so that would be the similar conversation when you look at how can we provide sport programming through our services, and what considerations do we need to make. So those are a couple of the pieces I know we've had dialogue with, and probably some of the questions that may pop up as we go through. But we wanted just to kind of touch on what our general conversations have been with those two areas prior to getting into some more specific best practices that Janet's going to speak to.
Okay, I'm going to talk just a little bit about facility protocols, and I'm not going to go on and on because in all honesty, you probably have more detail and information around this than I do, because you're more responsible for facilities. So I don't want to bore you. But the point is that I think I'd like to highlight is it's been quite amazing how people have been really creative and really vigilant. And I think that's why we've been able to keep this spread under control here in Manitoba. So just I do have a handout that's attached there that has all this information, but there's just a few areas. So generally, I think you all know that really it's adhering to the provincial government guidelines, which is part of the Manitoba Restoring Safe Services. And there's more information about sport and rec under phase 2. There's a guidelines handbook. And obviously, Kylo spoke to the online screening tool. And that's really interesting about, we have some sports who are actually putting someone there, and every time they come onto the field of play, they're actually asking each individual to do it. We do have some venues that are saying anybody comes into the facility, we're keeping a record in the event of tracing. Those are great plans. However, I would suggest that it's a lot of work. You need to have a staff person or a committed volunteer. If you put that in your protocol, you got to make sure you do it. And that's the key with implementing all of these different measures. So, I mean, the big key with all of this, which I'm sure we've all heard a million times, is around the social distancing and around good hand hygiene. So as we move forward, all of those kinds of things people know, but I think what we're starting to do is just we're getting tired of the messaging, and we're getting a little more relaxed. So again, I think these are things you probably know. So one of the things as a facility owner, you may want to do some extra training with your staff, or reminders to them. Signage, I think, is very effective. I think people are used to seeing it now, and it's just a reminder. Things like entry and exit into the facilities, again, that's often a problem to be doing the social distancing. And I know one of the recommendations is a different entrance and a different exit. So really thinking through a plan around your facilities is a good idea. The other one is the hand sanitization sort of units. And I know Sport Manitoba has a number of those. They can be quite costly. You also have to make sure that they're filled regularly or whatever. So again, there are a lot of considerations around this stuff. One of the other one is those high traffic areas like lobbies. I know in some facilities, I can't imagine how you can have one-way traffic or not have people congregating, but those are the things that I think are most concerning from the public health perspective. So thinking it through, doing a walkthrough, those great little foots on the floor, or some people do follow it and others don't. Any kind of concessions, they're under the restaurant guidelines. I'm not going to get into that because that really, in sport, we don't get that involved in it. The other responsibility is around spectator safety, and I would suggest some of the sports have been actually quite creative around this. And one of the things that we've seen is people closing off bleachers, or they're closing off every third or fourth seat or chair. And the other thing that we've seen in a couple of team scenarios is that one team and their family would sit in one section and be completely separate to the other team. The realities are probably that those parents or spectators have encountered one another if their kids have been playing on the same team for a while, but they don't have to have any contact with the people from the other team. Cleaning and sanitization, I think we're all probably sick and tired of hearing about hand sanitizer and the wipes, but again, those are the kinds of things that are expected, that facilities are upping their cleaning quotient and ensuring that some of those health regulations are followed. Washrooms, again, just more cleaning. I just will pick up on here. I know we own a fitness facility here, and one of the challenges that we get almost every week is when are the showers going to be opened? Well, unfortunately, they're not yet. So people are asking to come dressed and leave dressed. Things like the public water fountains have been bagged and are not used, so people are being reminded to bring their own water bottles and not to share them. Face mask is an interesting one. In some sports where there is some ongoing contact, particularly between a coach and athletes, some sports are requiring masks to be worn. I think in my experience, we're seeing a lot more masks here than we were before. There are people who are pretty adamant about not wearing them, but again, I think that's, it's really clear when you aren't able to physical distance, masks are a good idea. Again, officials, referees, that kind of thing. The dressing rooms can be some of the most challenging when you're putting multiple people in there, but the concept of thinking that through. So again, these kinds of things I've taken from some of the sport protocols that we've submitted, that some of them that run their own facilities are ones that they've highlighted that are important to their sport. So that is there as a handout, and it may be a good checklist for you. Moving on, I think the other piece is just highlighting what we've seen around the sport modifying either their game or some of the things that they felt were needed in order for the sport to be safe for their athletes. And again, one of those things is sort of that hand hygiene. The hand sanitization before and after the sport activity has been highly encouraged. They've been asked to sort of modify some of their drills, some of their actual activities that they would do during practices or training, so that they can maintain the physical distancings of 2 meters or 6 feet. That's a really key one within all of the sport protocols and all of the indications from health. The other piece, which has been a little bit confusing, but really key to the sport piece, is when physical distancing isn't possible, the contact should not last for more than 10 minutes of time. So the interpretation of that has been probably the most complex, because they've also identified that this 10 minutes is cumulative. So if you were running an hour practice and you had multiple interactions, it's still intended that the contact shouldn't last for more than 10 minutes. So for instance, in soccer, I know that they've, certainly for certain ages anyway, allowed unlimited subbing so that the kids won't actually be playing defense or offense against the same athlete for more than 10 minutes in a game. But again, there's been many interpretations of that, and we've been that's a question that we are looking for more direction when we meet with them next Tuesday. And then I again will compliment some of the sports just on thinking around things like, what if there's an injury? How do we address it? And most of them have had a good protocol around how they do that. Things like carpooling. A lot of kids, that's something that they do. So they've really thought that through. Another one is just, you know, the handshakes or the high fives and all that happens after a game. People are doing salutes and helmet taps and things like that. So, you know, those are the things that the sort of those general sport modifications. It is really interesting when we do look at the return to play. There are some sports where it actually hasn't been required, or the actual modifications to the game have been quite significant. And I think that's a kind of an interesting thing, because it could come to the point where the game is so modified that people either won't go back to the old game, or it could change the game forever. So, I mean, again, the one compliment that I'd send to the sport community is people have been taking this very seriously and are doing their best to ensure that these protocols are being followed and communicated to the community. So that's really all I want to say, and I'll turn it back to Kylo to just talk about the best practices.
Thanks, Janet. So just a couple things, I think, sorry, I keep clicking one too fast. So some of the things that we've worked with our sport partners on is just again, education piece around some posters or public awareness that we can create. And so Sport Manitoba has produced a couple of templates that provincial sport organizations can utilize. They can put their logo on it, and if they need to put it up in a facility. Some sports are talking about if in their return to play protocol they've identified a specific individual to be their COVID safety person, that person would have some posters if they're not in the facility, an outdoor facility potentially, or they're just not present where the participants are going to be, that they could put them up and take them down so that at least there was some awareness that they could provide. So these are some of the examples of the ones we've created and made available through our sport partners, and as well as a couple resources to help the coaches as well as parents or program deliverers. If you are been on the Aspen Sport Institute or some of the other organizations that have been looking at the youth sport specific return to play pieces, they have some checklists and some things that are a little easier and friendly to use, so that an individual could have it in their coaching bag, or a parent could use it, or a safety officer. And so these are two that we have come across that we like from the Center for Disease Control out of the US, that just sort of keeps things simplified. There may be other best practices and ones that the province has produced now as well. But early on, these were some that we could use and look at. And so those are a couple of the best practice pieces of information or posters. And I know the regional health authorities have also done a really great job of sharing that information throughout their jurisdictions. I saw one recently about hand washing for day camps geared towards the youth participants and helping support what that looks like. So that's really just some more resources that we have on the sport side. What gets us into the money part of the conversation is those questions and answer pieces that hopefully we can have. If there's some specific stuff there that you're wondering about, or more detail on some of the things Janet or I touched on. And MJ, maybe if we want to start with, I'm not sure if there's any in the chat right now. Did we lose MJ?
I think we put them to sleep.
Okay, I was reading it for a bit too long. Thank you so much, Janet and Kylo. We do have one question in the chat box. It says, hey guys, sorry if you've answered this earlier in the call. I was wondering if you have any idea of the timelines for Hockey Manitoba return to play plan. I think many of us are waiting for their plan to finalize arena returns to play plan.
Sorry, that's a great question. And actually, we did receive hockey's return to play plan on Friday. And it is one of those plans that, quite honestly, we feel that we need to have a face-to-face with the health authorities, because we have some concerns about how safe it really is to return to play hockey at the moment. And really, it's based on that contact. And my example that I can give you, so it feels more real, ball hockey has received a return to play, and they actually have had a very competitive season, but they've done things like there's no face-offs. If there's any kind of congregation or scrum of people, the referee has been told to blow it down very quickly. They've been able to physical distance on the bench because they don't have skates on to go over the boards. They've been able to separate people out. It's a little bit more difficult in hockey to do that. So there are some things that we want to have some conversation with health at and get some very specific direction. The three that we have, I think there are four that we have right now that are probably most concerning are contact rugby, tackle football, hockey, and actually indoor volleyball. So those are all on the agenda for us when we meet with Manitoba Health on Tuesday. So if they feel and deem that the protocol for hockey is safe, it will get approved very quickly. If not, we may see further modifications to what they've submitted. So that's the best answer I can give you.
Thank you very much. We have another one from Kelly saying, who is responsible for monitoring protocols put into place for PSOs? For example, we have baseball who has returned to play, but not always following return to play. Who checks, who monitors, and who follow-ups? And what is the city or the facility's responsibility?
Well, in terms of the enforcement of this, it really is a provincial responsibility. However, I'm sure that if you are seeing or hearing things about sanctioned baseball activity, you should be reporting it to Manitoba Baseball. Again, keeping in mind that in most cases, sports have done a really good job at trying to communicate what the protocols are. But again, it's left up to a local area association or an individual coach. And depending on their risk management, they may or may not be following proper protocols. So I would be reporting that to Manitoba Baseball, who then should be communicating further to those individuals. And again, if it's your facility and there's any liability for you, I would also raise that things directly if you feel comfortable doing that, or doing it in some way that's kind of maybe a bit more subtle, so you don't end up in some kind of major problem with it. But I think, again, everybody's risk tolerance in COVID is very different. And, the sports themselves, like I said, have been excellent in trying to enforce and reinforce the protocols. So if we are seeing them, I would report them.
And just to add to that, I think the execution of the return to play protocols really going to have to be a collective effort for us to move forward together with these approaches, and we need to make sure that everyone is sort of doing their part to keep everyone safe. We want to make sure that if we're going to continue to be able to participate in sport and modified sport programs, that everyone is doing their part. And so when we talk about that from a community to community, there really are going to be some dialogues that have to happen with the local minor organizations and the people providing facilities, so that we can keep sport happening at a community level and not be in a position where we're shut down again.
Great, thank you. I think we had a question from Gregory, and he's just trying to get himself unmuted. But while we wait for him, we have one more saying, did you say that tournaments are not allowed at this time? We have a baseball group who would like to have a tournament.
In most cases, they're not. Again, I would refer you back to baseball's protocol. We would be quite concerned about the size of the tournament if people are traveling, and that those protocols are very adhered to. So again, baseball is definitely competing. There are just some sports that aren't, but baseball, softball, soccer are all in competition phase. So I wouldn't suggest that tournaments aren't happening, but we're not strongly encouraging travel throughout the province or from outside the province, or large numbers of gatherings. Again, there are some restrictions even on outdoor spectators and the number of people within a facility, even if it is outdoors. So I would be asking lots of questions to the tournament organizers.
Great, thank you. I think that's all the questions we have in the chat box.
There's a number of people on the presentation that have my cell phone number already, and I did receive a text directly as a reminder for those people that are running facilities when we're thinking about our ice-based sports, that there may be other user groups too that would like to expand some of their ice time availability, that have return to play protocols already involved. And so if you are a facility trying to map out your plan around when to put your ice in, there may be some other organizations outside of hockey, if we're waiting on hockey. Granted, they're a big user group of facilities, but other groups may look to expand some opportunities now as well. So there might be an opportunity in our communities to look at those other user groups and see if they have slots that they would like to fill up with some of the availability, so that we can get, you can get your facility operational, and they might be able to expand some of their programming as well.
Great. Thank you so much, Kylo. Does anyone else have any questions? Okay, I don't see any. Yep.
For those that don't have my contact information already, you can find it there, and you can reach out to me if there are questions that come up after the fact that you'd like to get more information on, and we can figure out the person best appropriate to get the answer for you, or who to connect you with, so that you do have that answer.
Thank you so much, Kylo, and thank you as well, Janet. It was amazing for you guys to sort of respond to us very quickly and put together this very knowledgeable, impactful information. The handouts are going to be available as well on our website, and you can reach out to Kylo directly. The webinar recording will be available by Monday at the latest, and everyone will get an email with the link to the webinar recording, as well as all the other slides that were shared and the resources that were shared by Janet and Kylo. Thank you so much to everyone for showing up today, and enjoy the rest of your week. Thank you.
Thank you.